welcome back to Ahead of the Curve, the Scoliosis Experience podcast, where my aim is to empower individuals with scoliosis and movement professionals alike by providing free, up-to-date information on scoliosis management and treatment. My goal is to improve the quality of life for those with scoliosis and equip movement professionals with the knowledge and skills needed to effectively support them. Welcome back. I'm so glad you're here. I'm your host, Dr. Megan Teed. I'm a scoliosis specialist and a fellow scoliosis patient, and I really appreciate you taking the time out of your day to tune in today. We're going to be talking about how scoliosis PT isn't just about building back strength. There are many other important elements that go into your scoliosis treatment plan. And while obviously building your back strength is important, it is not the only thing that we focus on. There are many imbalances all throughout the body that also need to be addressed. So today I'm going to talk about the different muscle groups that we focus on. I'm not going to give you like an anatomy course or anything. I'm going to give you kind of a general overview of the different muscle groups that we address. I'm also going to talk about the different body systems that we include in our treatment plans, including the respiratory system, the digestive system, your visceral system, and your lymphatics. And then I'm going to finish with how to incorporate some of these things into your daily routine. I know it can sound really overwhelming when I'm talking about all these different things that you have to be adding in when you already probably have a very busy day to begin with. So no worries, it is possible without getting up at like 4:45 like a psycho like me. You can make these little adjustments in your routine so that it's part of your life, and it can be pretty simple. One of my clients, she said it very beautifully. She actually has a beautiful British accent, and I love listening to her talk in general, but she said that she's found ways to fold these exercises and routines into her life. So, and I think that's just such a nice way to think about it. You're not uprooting your life. You're not completely, changing the way that you go about your day. It's just little things that you are adding in here and there throughout the day that can make a big difference overall in the way that your body's feeling and the way that you're feeling about your body and your scoliosis. Hopefully, just making these little adjustments will take some ease, will add some ease into your life instead of stress. So the first thing that we focus on with a scoliosis physical therapy program or any sort of scoliosis treatment plan is learning how to elongate. And I've said this, I feel like I say it all the time. Maybe you're just listening to this for the first time, but elongation is the most important element of a scoliosis program. Learning how to lift your body and elongate your spine so that it's not in a compressed position. If you imagine a slinky or a coil, something that is wound and curved, and you hold on to each end of that slinky or coil and you pull those ends away from each other, you'll notice that the curves, instead of being tightly wound and really circular, they become more linear and lengthened. And that's the idea behind elongation. There's many different ways that we can elongate, but in addition to lengthening the spine, we're also elongating and lengthening the muscles along the side that run up and down the sides of your trunk. So those are your lat muscles. Those are your core muscles. Those are your pec muscles that run across the front of the chest. We're opening, we're lengthening, we're expanding all of those areas to prepare your body to strengthen within that elongated position. So that is the very first element of most scolio programs. And yes, while we are targeting the back muscles in elongation, we're also elongating and targeting many other muscles that I just listed. You're 80% of the way there if you just can learn how to hold yourself in an elongated position with scoliosis. The second thing that we focus on in Scolio PT is breathing. And while breathing is a normal function of human life, you have to breathe to stay alive. A lot of people that have scoliosis are breathing in a way that isn't very beneficial or not as beneficial as it could be. So because of the nature of our curve and because of the nature of what happens beneath that curve. So we have to think about the organs that are being affected, including our lungs, including our diaphragm, including our digestive tract, all those things. Those are also being kind of squished and compromised because of the nature of the curve. So if we learn how to elongate, first of all, that's going to open up and free up a lot of space for the ribs, for all those structures to expand and thrive. And then if we can tune into the proper way to be breathing, it can really add to the benefit of something that we do a bajillion times a day. So a lot of people that have scoliosis, they tend to be chest breathers. So I have another podcast that specifically focuses on breathing, and hopefully that will be tagged and linked in the show notes. Thank you, Sarah. But we use really small muscle groups in order to chest breathe. So those are your sternocleidomastoid, those are your scalenes that run along the sides of your neck. And if you're more of a chest breather, you tend to experience more neck pain as well. The goal is to be more of a diaphragmatic breather. So having about 60 to 80% of the movement coming from your belly hand compared to the chest hand when you take a deep breath. Okay, so just focusing on learning how to make that transition, that's the first thing that we focus on. And then we focus on something that is called global breathing or global expansion. And when you learn how to be breathing in that particular way, it not only helps to stretch all the little muscles that run in between each one of your ribs, but it also helps to strengthen those little muscles as well. And additionally, you're also strengthening your lungs. You're also strengthening your diaphragm. And then when those are strengthened and they're operating in an opportune way, your pelvic floor is working better. Your core muscles are able to fire better. Everything is just running optimally. So that is the second thing that we focus on in Scolio PT. So first we have elongation, then we have breathing in the right way. And then third is strengthening within that corrected position. So you can go and see a personal trainer or go to a general Pilates class, and you can get a pretty good benefit of total body strengthening in those sorts of environments. But when we are doing scolio PT, we use wedges, we use props to bring yourself into more of a centered alignment. So instead of resting in that curve position and strengthening within that curve position, we are working and giving you just a little bit of support and guidance to pull you in more towards a midline position. And then we work on strengthening within that position. So once we're in that position, we work on everything. So we start at the foot and the ankle here at Mindful Movement. And we try and make sure that the right side of the body is working in a similar way to the left side of the body. We really tune into what are the right and the left side of the body even doing. Because a lot of times with scoliosis, we have no idea. We think that, leaning over to the right and resting on our prominence is center. And until we are brought, have an awareness brought to us that that isn't quite a center position, we're going to be over here. So just beginning to learn, just beginning to tune in from somebody, observing you, from using a mirror as feedback and relearning where your center should be. So, and once we work on the foot and the ankle, we kind of build our way up the body. So we make our way up the length of the leg, and then the pelvis is the next focus. So in a standing position, in a sitting position, we learn how to balance our weight a little bit better so that it's not going to require as much effort to make all the other adjustments to bring yourself more to a midline. If you begin making those adjustments and corrections from the top down, it's going to be a lot more work, a lot more complicated, and probably kind of hurt. So again, working with somebody who understands scoliosis is paramount to having success in finding your ability to manage your scoliosis and strengthen in a really smart, intelligent way. So also the next thing that we focus on is visceral work. So not a lot of therapists include this in their routines, even if they are a scoliosis specialist. I feel like the viscera is pretty overlooked. Yes, we are focusing on breathing, and that's huge. So kudos to, all of the scoliosis specialty programs, for focusing on that, because that is part of your viscera, your lungs, your diaphragm, your pelvic floor, all of those things are viscera. But a lot of times we are missing out on working with our digestive tract. I have so many patients, so many clients who complain of chronic constipation, chronic IBS, gas, bloating, all those things that can be very, very uncomfortable, in addition to contributing to back pain. So learning how to manage and learning techniques to release your viscera and mobilize the viscera in a safe way. You're not going to go in and dig your elbow or a lacrosse ball into your viscera. I learned this from the Movement Rev, and I'm continuing to learn from the Movement Rev. I'm like a baby when it comes to knowledge on the viscera system. So check out her Instagram, her website, any of her continuing education if you want to learn more about that. I am actually going to take a course with her in a couple weeks, and I'm really excited to delve deeper into that element of treatment, because I think it is a big missing piece in a lot of people's scolio programs, because we can be doing all the right things for the musculoskeletal system, but if we're not paying any attention to the way that the viscera are moving against each other, they all form joints within our body. And if we have a visceral joint, so a joint meaning where the viscera are resting on top of each other, if we have a splint that's happening, it's causing things to bound down, it's going to prevent us from having the best effect that we could have on somebody's recovery and ability to be pain-free. And then finally, the lymphatic system is another system that I like to incorporate in my treatment plans. And this system is responsible for controlling our inflammation. So kind of like visceral work, we can be doing all the right things with the musculoskeletal system, but if we're not paying any attention to our lymphatic system, we might be having blockages within that system that are preventing inflammation to flush out of the body. So there's a special order to go in as you're working your way through the lymphatic system and clearing those blockages that is optimal. So working with somebody that really understands that is important, so that you're not going kind of in a backwards direction. So kind of a common thing that a lot of people are hopping on board with, which I think is pretty cool, is the dry brushing. And dry brushing is working with our lymphatic system. And it kind of is a little monitor, our lymphatic system. It's a monitor for our body. It's kind of reading and checking all of the systems and the way that they're balancing with each other. And then if there is something that is going awry, the lymphatic system kind of turns on high alert, and it will trigger a kind of a kill switch to go in and take out whatever is imposing and threatening our body. So if there's a clog or a blockage in that system, it just isn't working optimally. And some of the result of that is feeling really sluggish and tired, feeling a lot of pain, having bloating and digestive issues, constipation, and many, many other things. So that is really key. And that's something also that is relatively new to me to be incorporating into my routine. And therefore, I am going to be helping my patients to incorporate it into their routines as well, in a way that is smart and logical and the most beneficial for them. So after learning all of these different ways of helping yourself with your scoliosis, and these are all the ways that I implement things into my own routine, I want to teach you how to implement it into your routine. So the goal is to make it a habit and just kind of make it kind of second nature for you. So for me, I address my lymphatic system in the morning. I will do some deep blockage work, and then I will do a little dry brushing before I take a shower. And then also with my scolio exercises, I will do like a Peloton ride, or I'll do a strength training routine. And then kind of throughout that strength training routine, I'll do my pull-up bar elongations, and then I will do a Schroth breathing exercise. And if I don't get to sneak it in there, I try and sneak it in a little bit later and throughout the day. So just finding those moments where you have 5 to 10 minutes, maybe it doesn't even take that to do, a few of the elongation exercises at the pull-up bar, but finding ways that will be easy for you to incorporate it into your life. Make it fun. Turn on some music while you're doing your routine. Maybe listen to a podcast. I've been listening to my Murdoch Murders podcast or the trial, while I'm doing my scolio routine, just trying to make it something that is tangible for you and easy to do. I hope that you found this podcast episode useful. So just kind of as a summary, there are many other things that we focus on in a scoliosis physical therapy routine or program, or just a scoliosis Pilates routine. It includes elongation, respiration, strengthening the entire body, not just your back muscles, and learning about the way that your visceral system is working, how to improve the way that it's working, and then also treating your lymphatic system. So I hope that this was pretty insightful for you. Make sure that you are working with a therapist or a trainer who understands scoliosis, who is experienced in working with people with scoliosis as well, to help you develop an exercise program that's tailored to your specific needs and goals. So what works for me doesn't always work for the next person. Just coming up with goals for yourself in conjunction with your specialist, that's the way to go. Thanks for tuning in to another episode of Ahead of the Curve. I hope you found the information and insights shared today helpful in your journey with scoliosis. Join us again next time for more discussions on living with scoliosis and ways to support those with this condition. Until then, take care and stay ahead of the curve.